Hi, my name is Lizette, and this presentation is based on hysterectomy. Hysterectomy directly translates to the surgical removal of the uterus. However, there are four types of hysterectomy, which we will cover in later slides. And depending on the type of hysterectomy, the procedure may also involve removal of the ovaries, fallopian tube, cervix, and other surrounding tissues. Here we have a photo depicting most of the organs of a female's reproductive system. This would be the focus point at which the surgical procedure occurs. Women have hysterectomies for several medical conditions and health issues. Some of these common medical conditions include fibroid tumors, endometriosis, uterine prolapse, cancer, endometrial hyperplasia. I will briefly discuss a couple in the following slides. Fibroid tumors, or medically referred to as leiomyomas, are brain tumors that begin growing in the myometrium. The photo illustrates that the different types of fibroid tumors depend on the location of growth. Cause is largely unknown, which is why a treatment plan usually involves hysterectomy. Approximately 200,000 hysterectomies are performed annually due to fibroid tumors. Another health condition is endometriosis. In this condition, the endometrial tissues that reside within the uterine begin to grow outside of the uterine cavity. Similar to the endometrium, these lesions that begin to form respond to the hormonal changes of the woman's menstrual cycle by building up and breaking down, resulting in small bleeding inside of the pelvis. This leads to inflammation, swelling, and scarring of the normal tissues. There are four different types of hysterectomy that a gynecologist would advise, depending on the health condition of the patient. One of these types is total hysterectomy, which entails the removal of the entire uterus and the cervix. A second type is bilateral salpingo-oophorectomy, which is the removal of the uterus, cervix, one or both ovaries, and fallopian tube. This procedure is usually performed when cancer appears in the female reproductive system in effort to remove the cancer and or prevent cancer from spreading. A third type is radical hysterectomy, which involves a great deal of the woman's reproductive organs. It includes the removal of the uterus, the cervix, both fallopian tubes, as well as both ovaries, the top portion of the vagina, and most of the nearby tissue that surrounds the cervix. And lastly, supracervical or partial hysterectomy is the removal of the body of the uterus while leaving the cervix intact. When deciding to undergo hysterectomy, there are various procedures that can be resorted to when treating specific conditions. One procedure is abdominal hysterectomy, in which incision is made below the abdominal. This allows for better visualization. This procedure is commonly used when the ovaries and fallopian tubes are being removed, when the uterus is found to be enlarged, or when there is disease that has spread to the pelvic cavity. Vaginal hysterectomy is another procedure. In this procedure, it is often used in cases of uterine prolapse for menstrual abnormalities, given that the uterus is considerably its normal size, and in patients with benign diseases. Some of the advantages of vaginal hysterectomy is that it's less complicated, there's no external incisions being made, there's rapid recovery, and shorter hospital stays. The third procedure, laparoscope-assisted vaginal hysterectomy, involves just that, the assistance of a laparoscope, which is a thin, flexible tube that contains a video camera and is inserted through tiny incisions in the abdomen near the navel. In this procedure, the uterus is removed in sections, either through the laparoscope tube or through the vagina. This is an alternative to an abdominal hysterectomy but has not yet been proven to be superior than a vaginal hysterectomy.